Good afternoon, everyone. Welcome to today's Adults Health and Active Lifestyle Scrutiny Board. My name is Andrew Scopes. I'm the chair of the committee and I'm a councillor for the Beeson Holbeck ward in Leeds. Just so everyone knows, this is a formal public meeting, so everything is being webcast live on YouTube and I think on the council website, and you can watch it back later if you're so interested. Also, all the papers that we are looking at are published on the council's website. If you put into a good search engine, Adults Health and Active Lifestyle Scrutiny Board Leeds, it'll be one of the first returns up the top of the list so that you can see what we're reading as well. I'm going to start with introductions, if that's okay with everyone. So as I said, I'm Andrew Scopes, I'm the chair, and I'm a councillor for the Beeson Holbeck ward, and we'll go this way. Thank you.
Good afternoon, Councillor Ellen Thompson from Guiseley Road and Ward, substituting for Councillor Taylor. Thank you.
Good afternoon, Councillor Karen Renshaw from Arts and Robin Hood, substituting for Councillor Mohammed Iqbal.
Good afternoon, I'm John Beale. I chair Health Watch Leeds and I am a co-opted member of this board.
Councillor Mahaley Franson here for Moortown and Meanwood.
Good afternoon, everybody. Councillor Kevin Ritchie, Bramley and Stanley Ward.
Hi everyone, I'm Councillor Fiona Venner. I'm the Executive Board Member for Children's Social Care and Health Partnerships. I'm really just covering for Councillor Salma Arif, who's on our honeymoon, because most of these items are in her portfolio rather than mine. Thank you.
Hello everyone, Victoria Eaton, Director of Public Health, Leeds City Council.
Hello, Rob Wood, Intelligence and Policy Manager for Adult Social Care.
Hello, I'm Shona McFarlane, Deputy Director for Adults and Health, Leeds City Council.
Good afternoon, Caroline Barrier, the Interim Director for Adults and Health.
Good afternoon, my name's Richard Jones. I'm the Independent Chair for Leeds Safeguarding Adults Board.
Councillor Winkage, representing Morley South.
Hello, Councillor Conrad Hartbrook, representing Rothwell.
Good afternoon, Councillor Paul Alderson, representing Guiseley and Rawdon.
Good afternoon, everybody. I'm Councillor Caroline Anderson. I represent Adel and Wharfdale Ward.
Good afternoon. I'm Angela Brogden, the Principal Scrutiny Advisor.
Super. Thank you, everyone, for that. We're going to start by moving through the first few procedural items. I'm going to hand over to Angela to run through that. Thank you.
Thank you, Chair. Under item 1, there are no appeals against the refusal of inspection of documents. Under item 2, there are no items for exclusion. In relation to item 3, there are no late items. And under item 4, please may I ask if board members have any declarations of interest? And I shall take silence as none. Thank you very much. Under item 5, we have apologies from Councillor Taylor, with Councillor Thompson attending as substitute member, from Councillor Iqbal, with Councillor Renshaw attending as substitute member, and also from Councillor Gibson. And we've also had notification that Councillor Farley may be late as he's currently in the Council's licensing committee meeting. Thank you, Chair.
Thank you very much. Okay, move on to the minutes. Firstly, are there any points of accuracy in the minutes that anyone wants to raise? I can't see anyone indicating, so I'll take those as a fair copy. Angela, are there any matters arising you want to raise?
Yes, Chair, just a few. In relation to minute number 45, with regard to the board's earlier discussions around access to general practice in Leeds, board members were provided with the further additional information that categorised those GP appointments that were made outside of the 14-day time frame. In relation to minute 46, in noting the key indicators and areas of progress that were set out in the briefing paper that was provided by the Leeds Health and Care Academy, a request was made by the board for them to illustrate the trajectory of progress over the last 6 months in the form of charts and graphs. This has recently been received and circulated to board members with a commitment that these will feature in future update reports as well. And I just also wanted to go back to an earlier minute number 21, in terms of providing a further update. This related to the board's request to receive a briefing paper from the drug and alcohol team regarding the issue of cannabis use. This has been received by the chair, and the intention is to circulate that to board members following today's meeting, and to gauge views in terms of appropriate next steps. But the chair will also be picking this up during the work programme item later on in the meeting. Thank you.
Thank you very much, Angela. Are there any other matters arising that anyone wants to raise today? No, super. Okay, so let's move on to the first substantive item, which is the Leeds Safeguarding Adults report. And I'll hand over to Richard initially. Just so you know, you can assume everyone's read the paper, but if there's anything you want to draw out, please feel free. Thank you.
Thank you very much, Chair. It's good to be back with you. It's not a year. I think sometimes years go quite quickly. Well, I think we were having a scrutiny discussion some months ago, but I'm here to bring you our annual report for 22-23 and also our strategic plan for 23-24. And what I wanted to do just before I started, Chair, was just to say that Safeguarding Adults boards are a statutory function. Every local authority has to have one. Their focus is on people with care and support needs. So that might be somebody with a learning disability, somebody with autism, somebody suffering from drug and alcohol dependency, maybe somebody with a type of dementia or a physical disability, but as a result of their situation are potentially more vulnerable and at risk of abuse and neglect. They're not only people who are getting social care services from the City Council. They can be people right across the city who don't actually access either health or social care services. But that's our focus. That's what the board focuses on. We're a partnership, and we have really, I think, we work at two levels. The first level is at a strategic level. So what we do is we set out priorities for the city in conjunction with discussions with partners. We create strategies that link with other strategic bodies across the city, like our self-neglect strategy, which you might want to talk about. And we coordinate activity and priorities across the partnership. So we work at a strategic level, but then equally we work at a level that is about assurance. It's finding evidence and being confident that our procedures are working, that what should be happening when somebody presents with a safeguarding issue, that what happens to that individual is what our procedures set out. We work at an assurance level in relation to ensuring that partners are delivering their contribution. And we work at an assurance level in relation to ensuring that practice is person-centred and that we're improving and learning from what happens and from people's experience in the city. So that's what we do. We don't deliver anything directly. We're here influencing partners, and actually, I think importantly, and I think this is at a strategic level, kind of setting the culture, setting expectations for how it is that partners should be working together to deliver the most effective outcomes for citizens. That's what we are here to do. And I'm an independent chair because hopefully I'm able to bring some challenge that sits outside of any one of the individual partners, and encouragement too. Hopefully, it's not just challenge, but encouragement and perspectives from other places as well. We're a board that has a range of members, including all the health organisations across the city: the probation service, police, fire and rescue, the city council, housing, commissioning, and social work. So that's who we are, and that's really what we do. And before I say anything else, I just want to put on my record as the independent chair my thanks to the frontline staff in any of those agencies, across health, social care, police, fire and rescue, colleagues in the third sector who are so critical to the work we do with communities, volunteers, and finally citizens who work with us, often in difficult circumstances, to share what it is that we could do differently to make things better for them. So you're only as good as the people behind you and around you. And my thanks as the independent chair goes to all those people in some very challenging circumstances, I think, at the moment, for both families, individuals, communities and organisations. So my thanks, I just want to put on record for the work that people do. Chair, I don't want to say too much more. You have a report that sets out sort of 7 of our key priorities. We haven't changed our objectives. We're still about wanting to raise awareness, to be citizen-led, to learn from experience and to work across the city with partners and partnerships. I just draw 3 things out that I think are key to us at the moment. The first is our work with ethnically diverse communities, and we're now at a point with Safer Leeds and the Children's Partnership in the city, I think, of just moving into a second piece of work, and I've reported back on some of this in the past, where we will want to engage differently with communities, trying to work out what it is that we're not doing at the moment that would make a difference for them. So in a sense, working with their agenda, not our agenda. Secondly, I'd pull out the work we're doing around multi-agency working. There's been a whole range of impacts of COVID and the pandemic and the unwinding of that. One of them's been, and it's not just a Leeds issue, that organisations at times aren't just coming around tables and having conversations about what can we do in this circumstance for this family, for this individual. And we're doing some work with an external partner, which I think will influence national work too, because as I say, this is an issue well beyond Leeds. It's good, I think, Leeds is tackling it. And the other one I'd pull out is the work we're doing around self-neglect. So we launched our strategy at the beginning of 2023 in relation and response to a number of the reviews we'd done. We're at a point now where we've got through building awareness, Chair, and linking that strategy to strategies across the city and other partnerships. We're starting producing practitioner guides and practitioner training, and we're now into phase 2 of implementing what is a 3-year approach to how we as a city increase our ability to respond to self-neglect and people who at times, either with or without capacity, are making very poor decisions for themselves in terms of their own well-being. So you have an appendix attached to the report, which sets out some of the data from health and adults and health, and I'm happy to pick up any issues in there, and I'm sure Shona is too. I'm conscious that was picked up by the local press here in the city, I think yesterday or today. So I think I'll leave it there, because really the benefit is to hear people's questions and to engage in that part of the process. Thank you.
Thank you very much, Richard, and thank you for recognising frontline staff. I think it's something we as a board would want to echo everything you said around their partners at the table doing the hard work day to day. Really important, really important work. I'm going to open it up to questions. So if you've got a question, I'll bring you in. I'll start with Councillor Anderson.
Thank you, Chair. On the top line of the data sheet, number of safeguarding concerns, it stands at 13,526. In 2018-19, it was 8,714. So that's about a 55% increase in the number. Is there a trend or a reason why you think that shot up so much?
Thank you, Councillor Anderson. That maps a national picture of increased awareness, and I think what I would say is that in relation to safeguarding for adults, I think we're on a journey, and it's a journey that probably I think we are further down the road on in relation to child protection, and certainly further down the road on in relation to domestic abuse, although never at the end of the road. So I think we're still in a process of and a journey in terms of raising both individual, family, neighbour and community awareness around safeguarding adults. And as I say, I think that is a journey that we've still got to make more progress on. So, for instance, if you look at some of the ethnic communities in the city and the level of referrals we get from them, we know that there's still issues around awareness and underreporting. So there's an increase. It's a significant increase. It matches to a degree the national picture and what's happened sort of post-COVID. My sense, Councillor Anderson, is that there isn't a kind of threshold beyond which you would say, actually, it's now not good news. What we know is that within that 13,500 people, there are referrals that don't merit a further response, so can be quite quickly redirected or signposted elsewhere. We know, and it could well be that colleagues in Adults and Health might want to say something about this, that 1 or 2 partner agencies continue to push referrals through a process where at times probably there could be a different response made. So some of those could be as a result of that. But my bottom line here is that we want to be a city, I think, where people feel confident if they've got a worry or a concern or an issue, that they don't sit on it and do nothing with it, that they respond, and ultimately maybe talking to other colleagues or partners, then raise a concern. I think that's the sort of place we want to be. So if there's over-reporting, that for me is something that actually probably speaks to the work we're doing around awareness and general training of other partners. And it has to be set against the context, and it's almost impossible to pull one from another, of increasing challenge that both individuals and communities are facing in relation to cost of living, mental health issues, access to a range of other services. So it's all, you can't split those out, Councillor Anderson, sorry, but that increase is one that, as I say, matches the national picture. I think it speaks to increasing confidence that actually, if I've got a concern or a worry, I talk to somebody. I pick up the phone or I make an email inquiry to Adults and Health. There are some in there that probably shouldn't get there. There are some others that will get diverted and signposted elsewhere. But that would be my response. It's part of a national trend, and I think it's in response to both increased challenges for individuals and communities and the work we are doing.
Thank you. I'll bring in Councillor Venn and then you can have a supplementary.
Yeah, as you know, Councillor Anderson, I had the adults portfolio till May, so I did sit on the Safeguarding Adults board till quite recently. So I wanted to respond really just to reiterate what Richard has just said, that there's no doubt that the challenges of, COVID, post-COVID cost of living crisis have made people more at risk. But I would also agree that increased reporting is potentially positive because it means people are coming forward, and it reflects the work that we've done as a board and that's still happening about the work of the board being very linked to communities, working directly into communities. Richard referenced the work with people from diverse communities that we did primarily through voluntary action leads, which was specifically to address the underreporting and proportionately less safeguarding issues coming through from diverse communities. There's also a really strong partnership with the third sector, which is really important and reflects the fact that sometimes people, particularly in the most marginalised communities, may be more likely to approach a third sector organisation and disclose something to them because they're not statutory and they don't have statutory power. So we also have that strong relationship, and a specific relationship with Advonet, which is the advocacy charity in Leeds. They're very well represented on the board, and we've done a lot of work directly with their members, which includes people with dementia, people with learning difficulties. So we've really specifically prioritised raising the profile of safeguarding in some of the most marginalised and some of the most disadvantaged communities, and communities where people traditionally don't get their voices heard. So I would also share the view that some of the increase is about increased awareness, and that's positive. Thank you.
Thank you. I think you're right. It is positive that people are reporting these things, and it would be awful if it was underreported. They do need to be found and dealt with. So the outcomes of the reporting are important as well. People feel that they've been taken seriously and that they've had the outcome that they want, but I noticed that that has dropped slightly. I know it's still in the 90% region, but it's gone down marginally. So we just need to be satisfied that people are getting their concerns heard and that somebody's taking action.
Yes, I think we'll all agree on that. I can see nodding around the table. So yes, we should keep an eye on that number. That's well highlighted. Thank you, Councillor Anderson. Okay, I'm going to bring in Councillor Hartbrook next. Thank you.
Thank you, Chair. Like Councillor Anderson, I'm focusing on the data on page 25 of the agenda pack. And again, looking at the 2018-2019 versus the latest set of data, because it gives a good enough span that you can sort of see a trend. And there were a couple that jumped out at me. I just wondered whether you could expand on them. If you look at the inquiries by type, physical abuse has dropped quite substantially since from 39% in 2018-2019 to 27%. So presumably that's a good thing. But I also note that self-neglect is up from 3% to 7%. And I guess that's perhaps not surprising, but I don't want to presuppose as to whether that's to do with more reporting or to do with, the cost of living, inflationary pressures that have caused, more people to fall from just about being okay to not being okay. Thank you.
Thank you very much. What we know is that in terms of trying to capture what's happening to people, for many people, the primary, so we're trying to capture here the primary reason for the inquiry. So is it physical abuse or sexual abuse? Often there's going to be a combination of factors, and it could well be that what happens is at the point that the inquiry is undertaken, that's what it looks like, but actually further on there's further information to come out. So I think what I'm seeing there is no significant issue, particularly in relation to physical abuse, because I think what we're seeing is an increasing kind of awareness that actually there are other forms of abuse that maybe just sit underneath the surface, and as you undertake the inquiry that becomes clear. I think in relation to self-neglect, it's positive that we're seeing, not positive, I mean we don't want anybody to experience abuse or neglect, but it's an indication, I think, that the city through the board and its partnerships is understanding more about how we both identify people who are either at risk of self-neglect or neglecting themselves or making poor decisions for themselves. And it fits, I think, with the strategy and the learning that we've done. So we did a thematic review of a number of cases a year or so back, and on the back of that create a real focus for us around self-neglect. So in a sense, I'm feeling that recognises again what we're both learning and wanting to prioritise. So I think every year there's, in a sense, I think it's difficult to see any significant trends in some of those numbers, and some of the kind of principal reasons for why it is we're getting involved, because often there's going to be a multitude of issues and it will just depend on kind of what appeared to be the issue at the start. So I would be really worried if if something dropped in half or by half. I think there's something about actually over time, as you say, you're getting a bit of a trend, but it's for me not significant. 2 or 3 percentage points here or there. It would have to be quite a significant shift.
Thank you very much. I'm going to bring in Councillor Ritchie next. Thank you.
Thank you, Chair. Thank you for your report. Your passion and commitment comes across very strongly. So that's very reassuring as I'm a new member to this board. So I've not been involved with any of this before. So that's a good start from my perspective. A couple of questions. I've been involved with lots of workshops around LEADER, which is learning from lives and deaths for people with a learning disability and autistic people as well. I just wondered how this fits in with, I should have said I've jumped to SARS, the safeguarding adult reviews, bullet point G on page 22. I just wondered how those fit in with those SARs, if you're involved with those, or if it becomes apparent from the leader review that there has been neglect. Perhaps that should be reflected in future reports if that's relevant. And then the second thing, which may be a bit of a tricky ask, but I just, again, around SARS and the lessons learned, which we hear quite often. Is there any way to capture the benefits of lessons learned, from other examples where, something A happened, but because of what we've implemented, we've prevented further occurrences? I realise that might be quite difficult to capture, but I think it would be interesting, because often people do cite lessons learned again, kind of thing. Thank you.
Thank you, Councillor Ritchie. Leader reviews are undertaken with our health partners and through the ICB. So what we do is we get regular updates on the reviews that have been done, and the themes and trends that might be identified through that process. But it's a process separate to the board. And what you can say is that if processes are working well and somebody is subject to abuse or neglect, there will be a safeguarding concern raised. So that will be the starting point. So some people who might then have not. So we will pick up a number of people through safeguarding processes that would otherwise maybe have gone through a leader review. But the safeguarding process and the safeguarding inquiry will take preeminence. It could be at the end of that process that actually we decide, because we have to work to a set of statutory criteria, that actually this case doesn't meet the grounds for undertaking a safeguarding adult review, but it still involves somebody with a learning disability or autism in a health setting where actually a leader review would need to be completed. So then that review would continue. So the two are kind of aligned, but not they don't kind of completely overlap in any way, shape, or form. I hope that captures that bit of the issue. And it's a bit similar. It's similar with other reviews that we do. So we did a joint review with Safer Leeds, where a domestic homicide review, in a sense, was the kind of primary lens through which we looked at the case. But we undertook a safeguarding review in that process as well. So there's always something about not getting confused, but being really clear which process are we using. So safeguarding referrals will always be the process through which we explore what has happened in terms of abuse and neglect in terms of an individual, but might not necessarily trigger a safeguarding adult review itself. I think your question about the benefits of lessons learned is a really important one, but it's an incredibly difficult position to get to. What we are doing in Leeds through the work we're now engaged in terms of learning and development is wanting to get a balance. So unfortunately, often it'll be true of the children's partnerships and Safer Leeds at times, we look at issues through the lens of something catastrophically having gone wrong. Somebody losing their life or being subject to a dreadful abuse or neglect. And what we're doing increasingly is trying to approach both the work we do and how we engage with practitioners, not with a sort of deficit model, but actually trying to explore what's worked well in this situation. Why have we got a good outcome here? And it's at that point that we're starting to discover, and that's using frontline staff from across the agencies, their experience of actually what worked well here was me undergoing the professional curiosity training and thinking about capacity in a different way. And I applied that in this circumstance, and we had a different outcome. So I can't pretend that we can make it hugely more scientific than that and be able to say, as a result of 50 training courses, we've stopped. It doesn't work like that. I don't think you're expecting it to. But what we are able to do through both the work we do with frontline staff and through the work, importantly, we do with citizens, is to hear what actually worked for you. How's that related to the training and the work we've done today, and how do we then embed that further in the ongoing training and support and practice guidance that we provide to people? So that's how we're trying to close that loop and ensuring that we are building on what we know works and what it is that makes the difference. And ultimately, I think we have an ambition in the city, and I think it's nationally recognised that we start with the citizen and what works for them, and we end with the citizen and their view about how it's been and what could be different. So I hope that helps. But that's how I'd respond to that second, I think, really key question, actually.
Thank you very much for that answer, Richard. Okay, I'm going to bring in Councillor Thompson next.
Thank you, Chair. So in the report, it talk about partnerships with children's safeguarding. Just is something that's not explicitly mentioned, but just a question around the transition for perhaps a child who's been subject to safeguarding concerns, that transition into adulthood that's challenging in so many services, be it health, social care, care leavers and otherwise. If you're able to elaborate on that a little, of how the partnership possibly works in that, in bringing those vulnerable young people through, that would be really helpful. Thank you.
So I think, Councillor Thompson, primarily the issue there is about operational services in the city, who primarily children's services and adults and health services too, in relation to the procedures they have and the process that they have in relation to, as you said, what is often experienced as often a cliff edge. I'm not saying that's the experience necessary in Leeds, but a very difficult transition from a range of services that sit around a child or a young person to what is able to be provided to an adult. And that goes for whether it's health services, doesn't it? Community services or social care services. What we do as the three partnerships is we identify cross-cutting themes where we got evidence or concern that actually we're failing to support people, or we're not learning lessons. And so far in the city, we've not had a set of circumstances where we've had serious safeguarding concerns around a child that's resulted in poor outcomes as they move into adult services. So I've in the past and continue to meet with James and Jasvinder as it was, and our new independent scrutineer. And we do two things in those meetings. One is we look at the shared issues. So, in the report, you've got some of those in there in relation to our approach to was not brought and think family, work family. But we also look at specific cases if there are concerns. So at this stage, while we know it's an issue, it sits at an operational level, I think, and you'd need to ask questions of colleagues across those services. It would be an issue for us if either of those, the two key boards, the Children's Partnership or our Safeguarding Adult Board, had a situation where actually there was a real a failure in relation to effectively safeguarding an individual as they made that transition. And I'm not in any way suggesting that's not happened or could happen in the city. It's not something that as yet those two partnerships have identified. We know it's an issue, but it's an issue I think that primarily needs an operational response.
Thank you. Just you mentioned two people, James and Jasvinder. I think it'd be helpful for everyone to know who you're referring to. I think they're the chairs of the Children's Safeguarding Board.
Thank you, Chair. Yeah, thank you for picking that up. So James Rogers, who chairs Safer Leeds, and Jasvinder, who was the chair of the Children's Partnership, who's now left that role. And shame on me. It's I think it's Andrew, is it? Or Yeah, Andrew, who's now the new David, sorry, thank you. David Devonshire is now independent scrutiny, who I'm actually meeting tomorrow. So thank you for the tip on the name. I would have found the name before the meeting. So we're the three chairs of those partnerships that have, you know, a shared set of common issues and priorities.
Okay, Councillor Alderson.
Actually, Councillor
Oh,
Scopes,
yeah.
could I come in? I just
Yeah.
wanted to add one thing. Although I totally agree that it's the issue of transitions is primarily managed by operational staff, it is also addressed strategically in the city. So transitions is a priority in the all-age mental health strategy, in Future in Mind, which is the children's mental health and emotional wellbeing strategy, and in the children's safeguarding board priorities. And that's because we recognise that transitions, particularly in mental health services from CAMS to adult services, have been really problematic and had tragic consequences in some cases. So it's a priority for the city, particularly in mental health services.
Thanks for that, Councillor Benedict. Can I just push on that? My understanding, the reason the transition is so difficult is because there is a difference in provision statutorily for children compared to young adults, and that's at the age of 18. Is that right?
Yes, yeah, whether that's social care or mental health services, there is a difference there's a difference in provision, there are different services, different levels of resourcing. So yes, absolutely. And also transitions can be traumatic. You know, if you're in CAMS services and you're, linked in with workers you've got strong therapeutic relationships with, you feel, established and comfortable, you're transitioning at a time, you're transitioning in life as well. So we recognise adolescence is a particularly risky time. So, that's why it's important.
Thank you, Councillor Bennett. Bring in Councillor Alderson now. Thank you.
Thank you, Chair. Thank you for bringing this report. Just coming back to the increased number of safeguarding concerns, I just wondered how staff were coping with the higher number of cases, and with that, what level of resiliency is there within the service to deliver increased demands on the staff? Thank you.
Thank you. Just, really, really good question, and recognising that it is our frontline staff that will be responding. And also within the context of quite significant reductions in staff, we've got vacancies in social work capacity as well. So all the more really, helpful question. First and foremost, safeguarding is always number one priority. So wherever referrals come through, our social work staff, through a duty system, will respond to safeguarding pretty much above everything else. And that's where the resources continue to be sort of directed. Unfortunately, that's why we see quite a lot of people waiting for an assessment for equipment or for OTs or for other types of services, primarily because our focus is around safeguarding. And without a doubt, the increasing number of safeguarding referrals mean that the fewer staff that we have got are prioritising and spending more time doing safeguarding. But we also know that through the work that we do around prevention, it really helps to ensure that we've not just got a timely response, but that we're addressing where referrals might come through the safeguarding route, but actually quickly we can see from social work intervention that actually it isn't a safeguarding matter. It might be about a quality of care concern, and they can be routed appropriately elsewhere. You will see in the data on that appendix that the numbers of safeguarding concerns that have been raised don't always translate into then taking them forward as safeguarding referrals. So I'll just scroll down. Yes, so the number of safeguarding concerns have increased quite significantly in the data for 22-23 relative to previous years, but the numbers of then translating down into safeguarding inquiries is not so so great. And that's because we also know that we've, through our really promoting and advertising and talking to our communities about raising awareness around safeguarding referrals, we know got a lot of people routing referrals through safeguarding, but when it comes to it, we can work through and we can see that actually it's not a safeguarding matter that needs to be prioritised. So we see numbers increasing, we see them landing in social work teams, but it doesn't always translate into significant numbers of safeguarding referrals that they've got to progress. I don't know, Shona, if you wanted to add any more than that.
Thanks, Caroline. Just in terms of the staff experience, we offer a range of support mechanisms to staff to support them in what is an increasingly difficult and challenging environment, as you suggested. So we offer effective supervision, and we've got a new policy in place that supports people to reflect on what's happening and to have a really good wellbeing conversation every 4 to 6 weeks, so that we're keeping on top of those staff that may be struggling a little bit. We have a really good wellbeing offer. We have call them away days, but they're more like a half a day. But it's a chance for the team to get together and just reflect on what they're learning, to get some new input from some other agencies, and spend some time together developing. Unlike some local authorities, we've retained a office space for people, so there is somewhere for them to come if they're struggling. Other local authorities have moved to an office-less environment, and that is less supportive. And we've also got a really good learning and development offer for staff, so that they can pick up on those areas where they need a bit more input and put themselves on training to enable their development. So we're doing what we can to support the staff that remain. The other thing that we do on top of everything that Caroline outlined was where we identify that an agency is perhaps not getting their inquiries exactly right, we will have a conversation with them. So we recognise that pattern with West Yorkshire Police last year, and we spent quite a lot of time talking to them about the kind of referrals they were making and how to refine the referrals so that they were more accurate in their safeguarding referrals. And that helped us to reduce the number of safeguarding referrals from that source. I would say, however, that there is a no wrong door approach. If there is an incorrect safeguarding alert, which happens to be a requirement for service, we will always respond to that. It isn't that if the referrer gets it wrong, we'll pass it off. We will actually deal with it. So thank you.
Thank you very much for that. Caroline, you did mention a number of vacancies. Just picking up on that point, and I don't mean to put you on the spot, what's the current percentage of vacancies in social care, and how does that compare to other cities across the country? Thank you.
Thank you. Just confirming with Shona, it is still, we're operating at 26% staffing vacancies around social work, wellbeing workers, occupational therapists. So that's the average, isn't it? Across all three of those areas. I don't have the benchmarking data in front of me, but when we talk to colleagues in the region, we're not an outlier. They've got similar sorts of concerns. I think we've had more difficulty around what some local authority areas call social work assistants and we call wellbeing workers, and that was because there's quite a disparity in our pay rates compared to social work assistants that are in other local authority areas in the region. We've done quite a lot of benchmarking around that, and as a result of that we've been able to award a retention payment to the wellbeing workers to bring their grading up for a 2-year period while we undertake a more wholesale review to look at long-term solution, and that is already helping and having an impact.
Thank you very much.
Yeah, thank you for that. And I think it really highlights the challenge that the service is under, working with that kind of vacancy rate. Real credit to the team for persevering, and especially in a hard and emotionally challenging environment. I can't see anyone else indicating to question, so I'm going to close this item. I'd just like to say thank you really very much for coming. As Councillor Ritchie said, Richard, your passion is really, really positive and your knowledge is deep, so that's really important. And just for the board, you'll have seen on the work item, it's sort of tangentially linked to self-neglect, bringing a suicide awareness prevention action plan to the February meeting. I pushed Richard a bit on this on the chair's brief, but obviously it's not his direct strategy. So we thought we'd bring the right people who can talk in more depth about it. And obviously, Councillor Firth, who used to be on the board, asked quite a lot about it as well. So I think that's really important to say, that we'll be coming back to, I guess, extreme self-neglect is one way of looking at it. So thank you very much. We're going to move on to the second substantive item. Understand that Richard is staying for this because there's a link here as well. We've got two new people in the room. So can Simon and Magdalena introduce yourself, and then I'll bring you back in.
Yeah, thank you, Chair. Simon Hodgson, Head of Community Safety Services with Safer Leeds, Leeds City Council. Thank you.
Thank you. I'm Magdalena Boo. I'm the Head of Drugs, Alcohol and Safe Communities for Leeds City Council Public Health.
Yes, thank you very much. So as always, you can assume we've read the paper, but I think, Simon, you've got a little bit of background to walk us through, and then we'll move to questions. Thank you.
Thank you, Chair. Yeah, thank you, everybody. Hopefully you've had an opportunity to read the paper in your pack. This is around the thematic review of street-based lifestyles in Leeds. I think, first of all, I'd just like to start with saying much has been achieved over the last couple of years since the review was completed by the Adult Safeguarding Board and Safer Leeds. We've obviously had some national recognition of the work that's being done in the city in terms of innovation. And as you can see on the last page, in terms of some high-level statistics, we do compare favourably with other core cities. We are recognised as good practice relating to homelessness prevention, and for the collective action that the city takes for new presentations on the streets. Over this period, many lives have been turned around, and that's what matters. That's what matters ultimately, is people. September this year saw the 5th year anniversary of Leeds Streets Partnership. That's our multi-agency response to people living a street-based life. That was following an executive board decision to do a step change in the number of people on the streets. It remains a priority. We mobilise very quickly, and as I said, this is very much a strong and mature partnership that we have. We do have a governance arrangements, which most of you will be familiar with, in terms of a gold, silver and bronze arrangements, and connected to both the Adult Safeguarding Board and other bodies, including the Health and Wellbeing Board. At the core of the city's ambition is preventing rough sleeping happening in the first place, and this is important for a compassionate city. Any incidents of rough sleeping should be rare, brief and non-reoccurrent. And throughout the multiple pathways from street to home, the system, the whole system, needs to work together in an integrated way, making every adult matter and making every contact count. The issue of people living a street-based life is multifaceted. It's not a single agency issue. This is fundamentally a health and wellbeing issue, and it has to be a collective responsibility across the system. So anybody who is found on the street, who is at risk, is identified, is offered help, prevention. Nobody in temporary accommodation returns to the street, intervention, and everybody receives an appropriate offer of support and recovery. That's key in terms of our ambition. Much has been achieved, as I said, and the paper reflects some of those achievements. There's other stuff that I will just mention as part of my verbal update, Chair, if that's okay. However, we're not complacent. There remain significant and emerging challenges with real pressures in and across the system, some of which are in our control, some of which are not in our control. There remains that strong commitment to systems change from systems leaders, as well as that connectivity, listening to operational staff, and more importantly, the voice of people who are experiencing a street-based lifestyle. I think at this point, I'd just like to say a few other things that are probably not in the paper, if that's okay. Those who are not familiar with this subject matter, there are many reasons why people end up living on the streets. There are many more reasons why some people do not take up offer of accommodation. It's not one single issue. Nobody chooses to live on the streets as a lifestyle choice. and that is important that we recognise that. The Leeds Street Support Team and Partnership offers a high support, high challenge, as you would expect. The causes of homelessness are clear. There's a critical shortage, not only in Leeds, but nationally, of affordable homes. The soaring rents and housing benefit has been frozen. There is shortages of and pressures in the mental health and social care services. There are other challenges that those services have to face as well. Individuals facing homelessness are usually people who have suffered some form of trauma, whether that's in their childhood or early adulthood. Everyone should have the right to a safe and stable home. In Leeds, there are approximately around 26,000 people on the homelessness registered list with the City Council. Behind that, there's hidden homelessness, sofa surfing. We do have an issue of sofa surfing with young people in the city. That's why we need more accommodation in the city as part of our collective response. In terms of going back to the report, addressing some of those multiple disadvantages and inequalities that are in the system, we've come a long way, I think, in the last 5 years in terms of our understanding and our knowledge and how to apply that knowledge for change. We recognise that those on the street, those at risk of or returning to the streets, they're not a homogenous group, they are people first. They've all got unique personal experiences, histories and circumstances, and we shouldn't forget that. As I've already mentioned, many have experienced trauma, often in their childhood or early adulthood. That could include abusive childhoods, family breakdown, violence, debt, and that can be compounded by other multiple disadvantages. For people on the street with severe complex needs, often they display risky behaviours, which probably is what you associate with community safety in terms of that response to that trauma kind of thing. I think it links to what Richard was saying earlier as well. They are subjecting themselves as individuals, their families, the communities to harm or significant risk of increased harm. Many people have non or destructive forms of engagement, and that can lead to an exclusion and repeat cycle of rejection. And this is often linked to that trauma, that underpinning trauma, or a dismissal of self-neglect and self-care. Many have mental health issues, including a high prevalence of self-harm, and general poor health is evident. The most common specifically identified mental health issues are depression, schizophrenia, and other concerns and anxieties linked to personality disorders. I think what has changed coming out of COVID is also the ease and availability of the drugs available to people, particularly on the street, and this can affect an individual's decision to whether they use drugs or reduce their harm from a harm reduction point of view, and also accessing the right treatment for their substance misuse, and that is often linked to their physical and mental health, and often is also linked to the extended social network and the community. For those on the street for the first time, experiencing homelessness can make them extremely vulnerable. They face multifaceted challenges. There's increased risk of exploitation, violence and abuse, and then trafficking as well as part of that, linked to urban street gangs or criminal activity. I have to say at the last count, we do not have many young people. The majority of people on the street are over 25, and that's a recognition of the good work that's been done by our children's services and housing services around that transition period that's been mentioned. There are pressures in that system in terms of transition. We know many of the people on the street have had some form of care, been in care. So there is also a link there. Just in terms of many on the street, some, not all, but some will fall through the gaps between services and systems where they do not necessarily fit nicely legislative requirements or numerous organisational criteria or thresholds. And from their perspective, that makes it harder for them to address their personal issues and help them move on. As a result, many get caught in a revolving door. Having said that, we've had so many successes over the last couple of years. And as I said, we are leading in terms of new presentations to the street. We very quickly get people in the right package to support them and to be able them to move on. The street support do not give up on people. The partnership, which is very important in terms of our links with the third sector organisation, organisations who can offer generic and specialist support is really key. Every single person that is known on the street has a individual personal plan. Yeah, that is reviewed regularly. It's also part of a high support and high challenge. And that's important as we move forward. I'd like to just give you a bit of a case study, just to give you a bit of a flavour, if that's okay, Councillor. Brilliant, thank you. So this is about an individual male. He's been on the street for just over 5 years. Lots of risks associated, personal issues associated to him. During the pandemic, we offered accommodation. He did come in to accommodation, not sustained, returned back onto the streets. There's a history of trauma of that individual fleeing from another country and coming to this country. It's taken a long time to work with this individual to get him into the right place, be able to move him on. He was at risk of being attacked from other rough sleepers. He displayed all the signs and symptoms of self-neglect that you would expect for somebody in this situation in terms of their physical appearance and look. Completely malnourished, with that gaunt appearance, a heroin user, engaged with forward leads on and off in terms of his methadone script, very challenging, became an entrenched rough sleeper, very difficult for our operational staff to break that cycle. He didn't want to engage with services. You can't force someone to engage if they don't want to engage. And that relationship with the lead professional and key workers has been important. In and out of prison for minor offences, again, not helped in terms of addressing his behaviour. And that risk of exploitation from others in accommodation has been a key. I'm pleased to say, though, after saying all of that, he's now in his own tenancy. He's been there for over 9 months. He's engaged with mental health services in terms of his behaviours, in terms of his needs. He significantly had support in terms of therapeutic kind of offer to be able to manage a home, and managing a home is really important, and linking in with that social prescribing activity in the community he lives. Just coming back to the report, as I said, lots done, lots to do. It remains a priority. I think over the last couple of years, there's been increased integrated working between health, social care, housing and the criminal justice pathways. There are pinch points in the system, whether that's release from prison, whether that's discharge from hospital, whether that's recovering in the community. We are aware of those. There are things that are happening in terms of developing that, improving those pinch points and services flexing. As a council, we commission a whole range of services that some of you may be aware of. This includes daily street outreach, supported accommodation through the crypt. Beacon offer a commission through us. They provide 234 bed spaces with three intensive support environments with 24-hour support. We link in with Carbeck, which is a women's hostel. We are one of very few cities who has a female-only, gender-informed accommodation for women. And that came out of the pandemic, something of which I'm really proud of as a city that we've done that. We link very closely with Our Way Leeds and commission that service for young people. We also have St Anne's, who offer daily support to people in the city as well. There's a whole range of other services. Just in terms of innovation, just to give you a bit of a flavour, as part of some of the work that we've been doing, this is through competitive funding rounds through the Department of Levelling Up. We've increased our Next Steps and Rough Sleepers accommodation programme. We now have an additional 72 units of accommodation, and more importantly, they're offered navigation support. So they have support with them for as long as they need it to help them recover. We've done an exciting both public and private modular scheme in Kirkstall, which I know a couple of councillors in the room have visited. Really excited about that. Small units, got some really good successes in terms of people who have been homeless, been on the street, turned their lives around, got employment on that site, doing training, and they'll be offered affordable social housing once that site's finished. I think the work that we're doing with Forward Leeds is exemplary. Always more to do on this. We've piloted a number of schemes, including Buverdale, which I know Magdalena might want to speak about later on. As I said, there does remain pressures in the system. We're hopeful. We've got a bid in at the moment with the Department of Levelling Up around single housing accommodation, which will offer, if we are successful, additional units, which will include our housing first model that we have in the city as part of our pilot work. Summing up some of the challenges, Councillor, if I'm all right for time. Thank you. There remains demand for access to primary, secondary and tertiary healthcare. That is high. We know people who are homeless are more likely to attend A&E, but admitted for treatment and are less likely to complete that treatment. We've secured funding for the out of hospital work, which I think is really important in terms of that timely discharge, so they don't return to the street. And they're all connected in with our bronze and silver arrangements. We have a transfer of care hub from the prison and also from the hospitals, which again is important. We've further developed our offer for people coming out of prison in terms of their recovery, linking in with the private rented sector and registered social providers. I think one more thing I'd like to mention is some of the work that we're doing with grassroots organisations who aren't necessarily registered charities, but have good intent with volunteers. Over the last couple of years, we've moved this agenda significantly forward, I think, as a collective. We've moved it towards treating people with dignity on the streets, and that's important, I think. There is offer of food in the city. Some of you will remember some of the soup kitchens previously that we had in the city centre, the static soup kitchens, people queuing up, for food on an evening. We don't really want to see that in the city. It's not right for those individuals. There's no dignity in that. We've moved away from that with collaboration with the Leeds Homeless Charter. We now offer 4 nights a week food for people indoors at St Anne's, and that's run by the grassroots organisations. There are still some services that do a mobile offer on the streets, but they understand that they can refer them into the relevant services for support, and there's much work, good work doing on. So in summary, Chair, for the public, if people have concern and they are concerned about people that they see on the streets, they can make a referral into StreetLink. This is important. That referral comes in, it will automatically send an alert to our services, and we will connect with that individual. The majority of people, as I said, we know on the streets, but it might be just that moment, that alert comes in, that engagement, that connection that might make the door open for that person to move forward. Much has been achieved, much more to do, but as I said, we do compare favourably with other cities. Thank you, Chair.
Thank you very much for that, Simon. Really informative introduction. I really support the people first approach. I think that's really fundamental to everything we do, and I think it's the right approach. And thank you for stating the fact that no one lives on the street as a lifestyle choice. I think that's a really important thing to say and recognise. I just wanted, I know you've talked for quite a bit. I'd just like you to briefly, because I was fortunate enough to see the female only accommodation before it opened. I'd just like you just to briefly just say the services that are offered in those and at the round the clock support. I think that's really important to highlight as well.
Yeah, thank you. So we have an emergency accommodation for females only in the city. It is in the city centre. I won't disclose it. Those who need to know where it is. It is commissioned by the City Council and run by St Anne's Community Service. They are connected to with all our third sector organisations and statutory bodies, whether that's through Forward Leeds in terms of drug and alcohol, whether that's through navigation support in terms of move on into appropriate accommodation, whether that's through adult social care, particularly linked to our SARM, which I have to thank Shona for the continuation of funding in terms of the adult social care social worker. That's part of the team, really important that, very much in terms of that risk management. They're connected to all services and there's pathways there as part of that individual plan. I do have to say we've had some really good success from that. We've had over 200 women go through, you know, since it was opened in November 21. We've had some really good successes in terms of people getting their own accommodation, reconnecting with their families, moving on in terms of finding employment, and you know that's important that we have that gender informed response. Thank you.
Thank you very much, Simon. Okay, I'm going to bring in Councillor Alderson first.
Thank you, Chair. Thank you for this report. You know, it's an eye opener, and certainly I'm always interested to learn more about this. 2 questions. Am I correct in saying you said 26,000 people registered? Did I hear that right? Of that number, are we aware of how many people are sleeping in cars who may cover a wider geography and may not present themselves in the inner areas on the streets, but essentially are sleeping rough in a car every night for whatever circumstance, whether that be a lifestyle choice or something that, you know, they don't wish to pursue? And I guess the question relating to that is how do you tackle that? How do you approach someone who may be out, for example, it's been brought to my attention in my ward of Guiseley and Rawdon that there could be, or there is, people rough sleeping in cars who travel between Shipley, over the top between Shipley and Guiseley building area, but it's very difficult to track that down because they have the means to move around, which it's, you know, nobody wants to sleep in a car. Also, it's been brought to my attention, which leads me on to the second question essentially, is in the past I've tried to assist people who are sleeping rough in a car because they have companions in pets, mainly dogs. I just wondered how easy it was for those with pets to enter into the services offered, because I understand sometimes there is reluctance because someone may not want to go into hospital because they're worried about their companion, which when someone doesn't have a close family, you know, their pet is their everything, which I'm not suggesting it shouldn't be, but we need to, you know, approach that very sympathetically and make sure that they are encouraged into these services. So maybe I'm a bit naive to how you go about this, but you know, I'm always happy to learn. So be interested to know about that. Thank you.
I suppose I just wanted to. I think the pet point's really important one to pick up. It's been an issue for a really long time. I started my career 30 years ago working with street homeless people in London on a specific scheme that was about getting people with mental health problems off the streets who were street homeless, and it's really important that there are hostels where you can, and accommodation where you can take pets, because the reason people have a pet on the street, it's partly about companionship. It's also partly to feel safe, because it's really not safe being on the street. I suppose the only point I wanted to make really, and this is why I put my hand up, is I thought your presentation, Simon, was absolutely excellent in terms of the detail you gave, but also your really clear outline of the many multiple reasons why people end up on the streets. I worked for many years with homeless people. I've never met anyone who was homeless who didn't come from a history of trauma, and in the days before that was really recognised. But you know, most people on the street have got a history of trauma, very commonly sexual abuse or other forms of abuse, compounded by multiple complex needs. I recently supported someone who was sleeping in a tent in my ward, who had a tenancy in another part of the city. And I just wanted to just be really clear that even when someone is sleeping in a tent and not in their flat, that is not a lifestyle choice. That is a manifestation of distress, fear, trauma, and symptomatic of really, really complex multiple needs. This was someone who had very obvious mental health and alcohol problems and felt safer sleeping in a tent. I have to say, every single time I've referred to the street outreach team, they've known the person, which I always find incredibly reassuring and really impressive. And they knew this person and they worked really hard to get him out of the tent, which was, in the Abbey grounds. But I just wanted to be really clear that even if someone has a tenancy and sleeps in a tent, it's not a lifestyle choice. It's a reflection of the horrible traumatic history that person's had and their complex needs and their fear of people. It often takes, for very good reasons, people often lack trust in other people, lack trust in organisations. So even our compassionate, skilled outreach team can take a long time to get someone off the streets and into a place of safety. But fortunately, they are really skilled and really persistent. So thank you.
Thanks for.
Shall I come back to the councillor's questions? Sorry,
yes.
Councillor.
Can I just? Yes. Thanks for that. You're sharing your experience. I think your professional background is really helpful on this, Councillor Venner. Yes, Simon, can you respond to Councillor Alderson's question?
Yeah, no, thank you, Councillor, for raising those two specific areas, particularly in terms of pets and people sleeping in cars. Yeah. As I said at the beginning, in terms of our outreach service, we're out every day. Obviously, if you have see someone, use it in terms of referrals into Street Link or to Street Outreach. I can give you those contact details if you haven't got them. They will connect with those individuals in the car. They'll do the relevant assessment and appropriate assessment in terms of supporting them in their pathway out of that. That's first and foremost. If you ask me what the actual figure is of people sleeping in a car yesterday or the day before, I don't have those precise figures. It does vary, as you would expect, in terms of some of the pressures. Some of them are linked to not ultimately engaging initially with services because it's the first time they've been in that situation. They're not aware. Yeah, so it's really important that if anybody sees a person in a car who seems to be vulnerable, to do that referral to a Street Link or to our street support services, and they will connect with them to look at what opportunities they can support them. In terms of pets, absolutely right. As a city, we've actually struggled with this in terms of both emergency and supported accommodation, in terms of offering places for their pets to come. We have improved, I think, over the last 5 years. There is a number of offers in the city now where subject to availability, and it's always about availability as well, that people can take their pets to that. Whatever we do from a compassionate point of view, we try to understand that relationship that people have with their companion, the dog, and not to actually disrupt that kind of like relationship, because that potentially helps that individual in their therapeutic recovery journey. So ultimately, we've got more accommodation now available for people who have got dogs, but there is still a gap in provision. Does that answer your question?
It does, thank you. I wasn't expecting to send any curveballs back. It was genuinely because I'm interested to know. So, thank you again for the presentation.
Thank you for those questions, Councillor Alderson. I'm going to bring in Councillor Anderson next.
Thank you, Chair. Thank you very much, Simon, for all the work that you and your team do. I've been lucky enough to spend some time with the street outreach team. It was pre-pandemic on a very cold January morning. We turned up at 5 in the morning, Barry and I, to go out with the street outreach people. And the work they do is phenomenal. They know the people, they keep an eye on the people, they look after the people. And, they have an individual, really, really good relationship with the street sleepers. We've also been down to St Anne's and saw the fabulous work that they do down there, and I think we've got a really good story to tell in Leeds, and you've obviously highlighted that in your presentation. That's come across really well. Can I just ask a couple of questions on the figures here? So I think it just shows how how well we're doing with the number of people we're getting off the street and into accommodation compared with the other core cities on here. When does somebody become not a new rough sleeper? So we've got a line there with of which are new on the back page on page 10. So it started off at 13 down to 7. They won't obviously be the same people because at some point they won't be new. How do we work that out?
So these are new metrics that have been introduced by the Department of Levelling Up as part of the national plan to reduce the scale and prevalence of rough sleeping. That came in March this year. So this is to give you a bit of an indication of that. There are timescales in terms of presentations. Remember I mentioned briefly rare, brief and non-recurrent. So for each one of those, there is a time frame for a definition in terms of the data that is supplied back to the Department of Levelling Up.
Obviously, what we really want to do is stop anybody having to sleep on the street, and that's the massive challenge, but that would have to happen a lot earlier in someone's life, you know, to get the help they need at the time that they actually need it so they don't end up on the street. But, you know, we are doing as much as we can, I'm sure. Thank you.
Is that a comment or yes, thank you, Councillor Anderson. It sounded like a comment, but I think it's a fair point. Prevention is better than cure, I think, almost always. And I think it's interesting. You go back to what Councillor Venner and Simon said about trauma, and then we go back to safeguarding children as a starting point. Thank you. Okay, I'm going to bring in Dr. Beale next.
Thank you, Chair. Can I just join in thanking all those who have been involved in this work for tremendous work which they've done in Leeds. That really is showing that Leeds does care. And can I actually, an aside, thank Councillors Alderson and Anderson for their support that they've given, because if there is anyone, no matter who they are, who says it's a lifestyle choice, I hope that they've got some friends and colleagues who will take them aside, will take them out to see people who are homeless, to meet with those who care for them. And I hope they will then realise that they were wrong. But they need to be talked to by their colleagues. So thank you very much this afternoon. 2 questions, if I may. On the series of tables on page 9 and 10, the 2 last tables show that the number of people in Leeds that are going newly into accommodation and into medium and long-term accommodation is higher than any of the other comparative cities. And that's absolutely great to see. But I just want to ask a question about one of the earlier tables, which is the top table on page 9, where Birmingham consistently has a lower number sleeping rough on a single night per 1,000 population. I just wonder why they're doing better in that sense, and if there's anything that we can learn from what Birmingham are doing. How are they managing to beat Leeds? We need to be there at the top of the league, not in second place. And secondly, it mentions on page 7 about access to primary, secondary and tertiary healthcare services. Chair, those of you who've been on this board in previous years will have heard me being very critical of NHS England with regard to commissioning dental services. Although it's now, of course, the West Yorkshire ICB that commission dental services. But I just want to acknowledge the fact that they were persuaded to set up as a pilot in this city 2 dental practices which put aside sessions for treating homeless people. Not in the city centre as it happens. There were 2 practices that volunteered, one in Hunslet and one right out, as it were, on the northern fringes in Wigton Moor. But I understand that the homeless people are taken out in cars or taxis or whatever to that. I'm not quite sure how that's funded. I don't think it's from the NHS. I think it may be by third sector organisations. But anyhow, they're taken out. But I just wondered how the homeless people are identified to be taken to those two practices. I have to say that a long time ago, when I was a consultant in dental public health in Leeds, I did actually get them to set up a dental surgery in the York Street health centre, where the homeless people went for other primary care facilities. Sadly, and I don't know the background, that subsequently closed, but at least NHS England were persuaded to set up this, and it has been very successful. And indeed, the West Yorkshire ICB are now rolling that out in other parts of West Yorkshire. But I just wondered how the patients are identified. I don't know if anyone knows.
Okay, yes. So in terms of the people found rough sleeping on a single night and as a rate per population, obviously Birmingham is a bigger city in terms of population than Leeds. But in terms of the raw numbers, they're performing better than us currently in terms of that. We have a core cities group with other cities where we can look at good practice and learning from them. The Street Support Partnership, actually, when it was formed, one of the things I did do early on before we actually established the partnership, I went to see Birmingham and actually to learn from them in terms of their framework and their development. So they're on a slightly journey different from us, but we've actually learned lessons from Birmingham and other cities. We're not afraid to pinch with pride, because ultimately it's about people. And if we can learn from others as a learning city, we will do that. So we have those good connections in terms of understanding. Theirs is a different setup to Leeds in terms of the offer of accommodation, in terms of council properties in particularly. Luckily in Leeds we have council properties. Birmingham is a different setup in terms of their council offer, but they do work very closely with registered social providers and registered and private landlords as well as part of that. In terms of the dental one, my knowledge isn't particularly good on this, if I'm really honest. What I do know is when our services, operational staff are doing an assessment, if there is an issue identified with people's teeth, we will make referrals to relevant agencies through the NHS, through that link. There's a number of grassroots organisations through the Leeds Homeless Charter who have made representation to NHS Leeds, particularly the out of Leeds one that you talked about, and that connectivity, that's really good. So they're thinking about that person as a whole person in terms of their look and feel about themselves, those individuals. There's work going on around the health and wellbeing offer within the St Anne's Resource Centre and the GP practice there. I think there's opportunities moving forward in terms of that configuration offer of that wellbeing offer, including dental services, for it to come back in there moving forward. I do know the Crypt as well have a link with dental providers, and they do offer regular surgeries at the Crypt as and when needed. Hopefully that answers your question.
Thank you very much. Okay, I'm going to bring in Councillor Ritchie next.
Thank you, Chair. And yeah, I also welcome your comments around street homelessness not being a lifestyle choice. And I think that's born, I've known you a few years now, from your experience working in the field, and Councillor Venner has also added to that as well. And I think that those experiences carry much more weight than a government minister from the high privilege of the Westminster bubble. I think that sort of comment is something you might pick up off the Facebook comments. Some of the other reasons I've found when trying to support people, which you may be able to feed into housing strategies and what have you, are a lack of local options for the emergency accommodation. So people are rooted in the communities and they're fearful of going somewhere else for many reasons that you've articulated both in the report and yourself and Councillor Venner speaking this afternoon. So having options in all areas would be beneficial. There's also, I found, a lack of confidence in some of the places. So probably what they've heard, you know, this place isn't safe, there's drug users there, and if they're trying to come off and so on. So there's that lack of confidence, which again, Councillor Venner alluded to, that suspicion of services and what have you. So overcoming that barrier, and Councillor Alderson mentioned pets, which I've jotted down. The question I did have, which you kind of answered, was around working with the informal support groups. But what you said about it led to another question, which here it is. And it's whether, now that they've become more established at St. Anne's, do they have access to training around safeguarding that we'd have all our other staff and what have you? And of those that are still operating on the streets, again, is that offer open to them? I think I saw in the press of it a relatively new religious-based group, Sikh religion. I think I saw in the press. So are they offered that support as well? Because obviously they're vulnerable people, and I'm not saying this has ever happened, no evidence of it, but potential volunteers might see that as an opportunity to exploit vulnerable people. So it's making sure that those organisations have access to all our safeguarding package, I suppose. Thank you.
Yeah, I'll pick that one up first because it's really important in terms of safeguarding and protecting vulnerable people on the streets. So all the grassroots organisations that are signed up to the Leeds Homelessness Charter, that's run through a commissioned service and links into the work that's been delivered through the grassroots organisations, are offered safeguarding training, and it's really important that they do that. They can't be part of the charter unless they sign up to it and all their staff are trained and have the basic understanding around safeguarding and vulnerability. Really important. They are provided with a range of training opportunities throughout the year, depending on the subject matter and the need at the particular time. So that offer is there. If any of the grassroots organisations want additionality, they can come through to our street support partnership, and we offer specific bespoke. So we've done quite a number of offers around understanding the use of substances and a harm reduction model. We've done that with Forward Leeds and the grassroots organisations. So we're bringing specialists. Yeah. Thinking back to the emergency accommodation offer and the supported accommodation offer in the city, as I've said, I think where we are now, we're in a better position than we've ever have been in terms of the offer. There is still more to do. We do need more blended offer and a variety of offer. What's right for one person isn't always right for another person. There are still some kind of myths around some of the providers and understanding of what they offer. Very much we do it from a safeguarding perspective and that vulnerability of that individual. Try and place people in the right place for them and their needs. So yeah, it's a bit of a combination answer, that one, Councillor. Yeah, thank you.
Thank you for that. Okay, Councillor France-Meyer.
Thank you for your presentation today. You and the team do a fantastic job throughout the city and so on. Something that I just wanted to pick up on, which is mentioned in the report, which I do know that you've had some work to do with, is what work are you doing around end of life care for those that are homeless, and how you signposting that on and how you're dealing with that? Thank you.
Yeah, it's a very emotive subject, isn't it? And we do have a current service that is available at St Gemma's, which I'm sure you're aware of. And I know there are some complications there moving forward, but also some opportunities in retaining that service. It's really vital in terms of the narrative around dignity, that people do have that end of life care and support that they need. For me, that's really important. We do know the life of people living a street life-based life is actually ends very soon. You know, for women, I think it's about 42. For men, it's about 47. Off the top of my head, it's something like that. That's horrific in this day and age. You know, so we need to make sure that those conversations are happening in terms of that dignity approach to end of life.
Victoria, do you want to come in?
Yeah, thank you, Chair. Can I just make an additional comment to Simon's response on that? I think that there's often something that comes through as a theme when we talk to our NHS colleagues around the needs of very vulnerable people. And there is something really important, which is as much as we're really proud of the specialist services we have for different cohorts of people, people are still fundamentally entitled to NHS services. And there's an ongoing kind of partnership with our NHS colleagues to make sure that they do see people, including people living street-based lives, who are fully entitled to everything the NHS has to offer. And often we get examples that because we've got such great specialist services, NHS colleagues are less kind of proactive in seeing people than we'd like them to be. So this is something that we're even though we have kind of parallel services to some extent for particular groups of people, we still absolutely support people's right to access mainstream NHS services. So if somebody's at end of life in the city, they would be entitled to go into St James's or LGI just the same as anybody would from a home address. And so because we can't fulfill everybody's health needs with a specialist service. So there is something about sort of working with and pushing back sometimes when kind of mainstream services are busy, and often these people there is some pushback because of the kind of capacity it takes to kind of deal with the issues that people present. So it was just a comment on that we have to do both, and we can't run all of this on specialist services. Thank you.
Can I come back on that one? Thank you for picking that up. Absolutely correct. And I think that's across the whole system. There's something about, whether it's a universal service, a targeted or a specialist, there is something about our universal services flexing. Yes, they have legislative requirements and criteria across the system. And we know that, but sometimes it's how those services flex, a little bit more to support those individuals through universal service. Thank you, Victoria.
Yes, thank you. And I think that making sort of ensuring advocating for people who are struggling is really important. So, for example, end of life service might be used to dealing with people who are generally older than 42 or 47, and so it's a different service that's needed, but it's still a service that's very much needed. So, very much support you advocating for vulnerable people. Okay, I'm going to bring in Councillor Farley next.
Thank you, Chair. Just like to say thank you, Simon, because this is a really, really important report, and what has really come through in your presentation has been the passion of yourself and the team on this subject, and I think it's really timely that we should be discussing this following the absolutely vile, utterly immoral comments made by the Home Secretary over the weekend with regards to people choosing homelessness as being a lifestyle choice. So I do thank you and the team for what you've done. One of the things that in my ward, Bermondsey and Richmond Hill, we are just on the edge of the city centre, and increasingly we are seeing people experiencing rough sleeping kind of within our community, sort of going out down York Road towards East End Park, Osmondthorpe. And I suppose my question really is a question of geography. Does the distance from or proximity to the city centre kind of impact on an individual's experience of homelessness, and the do they have any additional needs from the service, or is there any qualitative difference between the help and support that they're receiving by not necessarily having those services immediately nearby? Thank you.
In terms of the offer, it should be no different from anybody, whether it's city centre based or outside the city centre. The Leeds Street Support Partnership is a city-wide service, and that connects with other statutory services across the city. In terms of some of the presenting issues of people outside the city centre, there can be a difference in terms of some of those issues relevant to those particular circumstances, and that's about how we connect with those individuals to understand. We do see the vast majority of people sleeping rough are city centre based, but from our last count, there was over 10% were outside the city centre, and we cover that in terms of that connectivity. Answer your question, councillor.
Thank you. Just moving on in terms of the people who were seeing, kind of identifying as newly having experienced homelessness. Are we seeing any patterns within that cohort, or is it Councillor Venner and yourself have both made reference to people who've experienced trauma, who've experienced like significant upheaval and problems within their lives, but how are we seeing anything different with the latest cohort?
I think all of those that are on the street have some form of trauma. All different, all unique. There's some commonalities that you can pull together as part of that. In terms of the current picture, in terms of new presentations, as I said, on the last count, there was nobody under 25, but the age in which people are presenting first time is coming down. So when I started this work, it was probably in the mid-30s and above. It is coming down. So we recognise that in terms of the offer then that needs to be provided. We have seen over the last couple of months in the city a small increase in the number of women presenting on the streets, primarily in the outer areas, but also in the city centre as well. So that brings a different challenge, in terms of the increased risk and vulnerability that women may face being on the street as well. And obviously as a partnership, I'm really proud of the operational staff across the system. They will flex, they will provide a trauma-informed response, they will connect with people, and if something isn't right, it doesn't work, they'll look for alternative solutions. They're very much solution focused, as you would expect.
Thank you. And I think if I think to call it a positive story might be a bit too much, because obviously while we still have people experiencing homelessness, sleeping rough, it's still obviously a major issue that needs to be addressed. Now I suppose here's a question, sort of I'm going to ask you sort of like gaze into your crystal ball and outline any sort of future challenges that might be on the horizon, and what we as a local authority and working with partners can do to avoid any future challenge or difficulties. So I appreciate that's a little bit of a ambiguous question, but I think if we're aware of things on the horizon or areas where we can take intervention sooner to avoid issues later down the line, I think that's important.
Okay, I think one of the potential challenges that is coming forward is with the changes in the immigration rules and regulations, particularly in terms of assessments and in terms of status. Other cities have already seen an increase of people coming onto the streets. We haven't seen that in Leeds. There is a good infrastructure there in terms of that partnership arrangements, particularly around people who are seeking asylum, refugees kind of thing. There is a potential risk there moving forward, but I feel we've got the components there to make sure we're planning in advance and preparation that needs to be done. There will be some, sadly, but that is how we mitigate that risk and how we work together accordingly. I think as I kind of indicated earlier, in terms of the drugs market, it has changed. It is an issue in the city, and if you are, not all, but if you have had trauma in your life, for some it's a way to escape. and block out, you know, what's happened to you in the past. I think the challenge is around how do we mobilise our resources quicker, faster, to get in there earlier in terms of that prevention and doing that harm reduction kind of framework that we've got around people so they can access treatment earlier and help them to recover. I think the other challenge, as I mentioned, is some of it are in our control, some of it's not in our control. I won't say any more on that. I'm sure you'll understand what I mean on that. Yeah, thank you, Councillor.
Thank you very much. Okay, I'm going to bring in Councillor Hartbrook next.
Thank you, Chair. Firstly, I just start to re-echo what's been going around the room, that homelessness isn't a lifestyle choice. And I really do welcome what is clearly a very successful picture for what Leeds is doing on this. It's not an area I'm hugely experienced in. I was lucky enough to visit St George's Crypt on Christmas Day last year, when my own local Christmas dinner that we do for the kind of the elderly had some substantial amount of food left over just because of attendance levels, and I was able to visit the volunteers working there midday on Christmas Day, presumably, you know, giving up their time. So it just emphasises that we are a very compassionate city, and both what we do as a council and with the third sector, I think ought to be applauded. One small question, and I guess one comment on the pack. And I think you mentioned earlier on that some of the reporting metrics have changed, so that this might partially account for it. But the data goes from September 2022 to March 2023, which is only a 6-month time horizon. And as per the previous agenda item, which I think went back 4 or 5 years, it's good to get in these things to get a larger span so that you can see the long-term trends rather than just a snapshot. The question I've got is, as a city, it's clear that we're getting really good outcomes compared with our peers as cities. Do we put more resources in, or are we just better at deploying the meagre resources that we've got?
That was a tricky one. Just going back to the metrics and the kind of like measures that have been introduced. I can only share what's in the public domain, obviously, in terms of information on there, but we do have this information on a monthly basis and more behind this that is shared with our representatives, you know, from the Department of Levelling Up. I can't do any comparisons with others within the public domain. What I can say is we have seen, as I said, a couple of increases over since March on streets. There is a seasonal issue as well that we need to reflect in terms of the counting. You know, we've seen it go up to our highest this year was in August, 57. Our last count last month in October was 46. That's a snapshot in time on one night that we do that monthly count. We're probably dealing with, you know, between 120, 160 people who are in and out of the system at various points in Leeds specifically, just to give you a bit more flavour on that. And it does, as I said, it does vary. We are compared nationally with the November autumn count. Our counts are robust. I'm proud of that. I'd rather us be honest and absolutely tell the truth in terms of where we are as a city. Because if we don't know what the numbers are, we can't then look to explore something differently on that. And sorry, what was your other question again, Councillor? Yeah, I think the council's commitment to this agenda has been really good in terms of that continuation of funding it offers in terms of commission services year on year on year. The financial envelope has got smaller, as you can imagine, but that commitment is still there in terms of the commission services. What we've had to do in terms of additionality is we've competed with other cities to get money in as part of our innovation and change, like the Somewhere Safe to Stay for women, like the Clarion and other examples that I've given previously. What we have got is a good infrastructure and understanding of the issues and can bring together that picture to be able to put forward a change in terms of our bids. So we do compete well when we put grants and bids in, and that's a reflection of how important this issue is for the city. Thank you.
Thank you very much. Okay, I'm going to bring in Councillor Thompson next.
Thank you, Chair. Thank you, Simon. I think what really strikes me is the compassion and the understanding of the issues and the trauma and all the rest of the burdens that the folk are carrying, who the teams are working with, and the willingness to tackle that head on is incredible, quite frankly. It's sad that we have to compete, but it's encouraging that we are doing well on the bids. It's just a shame that everyone has to go bidding for the crumbs from under the table. But congratulations on the successful bids to those concerned. Just one question, quite specifically on the last two tables, on not so much on the newly accommodated in off-street accommodation, but the bottom of table 10, page 10. Newcastle appears to be a bit of an outlier in terms of their numbers in medium and long term. I'm wondering if there's anything, I'm aware that affordability of accommodation in Newcastle is somewhat different from other cities. But also, is there anything we can learn from that? Do we know what it is that they're doing that's been successful in that regard? Because being able to get people long-term support in accommodation is clearly a really powerful thing, but just wondered if there is any insight to that. Thank you very much.
Yeah, a little bit of insight. There's more to do. We like to learn from others, absolutely. And through our representative from the Department of Levelling Up, who we meet regularly and monthly, they share good practice from other cities. That's important that we do that. I do know Newcastle very much in terms of that navigation support. They do get that in slightly earlier than Leeds does, and that helps in terms of moving people into medium and long-term accommodation. That's something that we've picked up locally. We'll be starting our refreshed housing first kind of model with funding that we've got. This will enable us to purchase and refurbished local authority properties to enable people go from street to their accommodation rather than going through all the pathways that happens. It needs to be right for that person. For some it will work, for some others it won't. So the navigator role through Barclays is going to be really important in terms of that connectivity and understanding what will work. I think it goes back to one of the Councillor Rich's concern as well around the offer, the blended offer, and where it is and how that works. For someone to be successful, you want them to have a safe, stable home in the right place for them as that individual kind of thing. The latter part of that isn't always there because of what we have in the system, but with increased offers that we can get through this funding, that will help. Does that answer your question, Councillor?
It does. Thank you. That was really helpful.
Thank you. Okay, Councillor Renshaw.
Thank you, Chair. Thank you for everything that all the information that you've given out and shared with us today. It's been really useful and I think a bit of an eye-opener to all of us. I'd just like to ask if there's any specific hotspots apart from the town centre, or are there any unidentified homeless sleepers that on the outskirts, because there are many town centres. I mean, my ward doesn't have one in ours in Robin Hood, so I'm just wondering whether or not I've got any rough sleepers in ours in Robin Hood. But there are town centres like Seacroft, Darnley, Morley, Rothwell, throughout the rest of the city. And I just wondered if there were any areas that were specifically of hotspots, or that we should be keeping an eye out for those homeless people.
I wouldn't call them hotspots personally. I understand what you're saying. I think there are some areas that are more prone because of the activity or what's happening in those communities. There are a few, and we are aware of them, in terms of the offer and support packages that put in place. As I said, it's predominantly city centre, but there are some outlying priority neighbourhoods, linked to multiple disadvantage, and the offer there in terms of accommodation in those areas. There are on occasion some of the outer areas where we do see homelessness and rough sleeping, and we can't forget that. There's pressures in every area, and we can't forget that either. So, does that answer your question, Councillor?
Can I just ask, is there a map, are these mapped out? Is there a mapping system that would be available to help us, you know, to support the homeless people?
We do have a really good intelligence picture of the scale and prevalence across the city, and that's refreshed regularly through our intelligence profile and pictures that we do from a strategic and practical operational point of view. I'm not sure that would actually help you in terms of greater understanding. I think the important bit is around that awareness around, if you see someone, don't walk by. You know, you could be that person who opens a door to help that person engage with the relevant service for those needs, for that person. You know, if we talk about active bystanders, if you don't want to engage with that individual, that's fine, that's your choice. If you have concern for people rough sleeping, I would really strongly recommend people to do that referral to StreetLink and through the Leeds Street Support Services, who will get out there as quickly as possible to connect with them.
Thank you. And just to confirm, it's a citywide offer. So wherever you are in the city, you phone the number and the service will be there. Thank you.
Yeah, absolutely. It's a citywide offer. I can send Angela the link for the StreetLink, so everybody's aware of that, if you're not already aware.
Thank you. Okay, I'm going to bring in Councillor Alderson.
Thank you, Chair. I appreciate I've already asked a question, so I will keep it very brief. It's a question that I've asked previously in a different form, actually, as a councillor who represents one of the outer wards. I just wondered how effective any cross-authority collaboration, if any at all, how effective it is, essentially, for those who may move from one city to another. Because if I'm understanding this right, it could be that if someone was to move from Leeds to Bradford, it could reflect on your stats that's one less, but one plus there. So it's essentially moving an issue around, not suggesting the person is an issue, but you know my terminology there. So yeah, I was just wondering about that collaboration, please. Thank you.
Yeah, we do have collaboration with our near neighbours and extended neighbours as well. So we do see some people presenting on the street from other local authorities areas, yeah, including Bradford, including Manchester. You know, what we do is collaborate with each service area in terms of what's right for that individual, in terms of the offer, in terms of accommodation, and that whole assessment in terms of priority needs and connection to the local area as well is important that we need to consider, you know, and also listen to that person's individual reason why they're in Leeds. Do they want to reconnect to wherever they've come from? Is there a reason why? Usually there is, why they've presented in Leeds, you know, going back to some of the issues that we've already mentioned. So there is cross collaboration. I think also where we've got people coming out of prison who have been former rough sleepers, who aren't necessarily Leeds residents and have been in prison for some period of time. We work very closely with housing options in terms of that offer, whether that's support to enable them to move back to where they want to be, or whether that's support in terms of where they're currently living.
Thank you. No follow-up. It's very encouraging answer. Thank you very much again. Thank you.
Thank you very much. Councillor Farley, you've also indicated, I know you've had one, but so quick, and try not to be too political this time. Thank you.
Me political, never. Yeah, no, it was more of a comment. It was just following up on the StreetLink. I have used StreetLink on a number of occasions, flagging concerns with regards to individuals who presented as rough sleeping. So I would encourage all colleagues to use that service if ever they're faced with if ever they find somebody in that situation, and I would hope that nobody would walk by without saying something. So yeah.
Thank you. I'll take that as a comment. Thank you, Councillor Farley. Okay, I can't see anyone else indicating. So for that, thank you very much for that report. I think it's really helpful, and I think it's really important for us to hear a lot of the work that's going on and assure ourselves as a scrutiny board. And I think it's also been, I really appreciate Richard you staying here, because from a safeguarding perspective, obviously people who have street-based life are very vulnerable, and so making sure they're on the agenda personally is very important to me. So thank you very much. Our final item is our work schedule, and normally everyone leaves, and I just encourage Victoria to stay because I think we'll have something that might be interesting. It's normally pretty brief, so hopefully everyone's seen the agenda. Just a few things I'd like to draw out of it. So firstly, there's a note of the children's neurodiversity briefing we had in private session. If there's any comments on that or questions, do you want to ask them now or accept their true record? I think everyone's okay with that. The second thing, this came only a little while ago, was the letter about Leeds mortuary services, and I wasn't part of the board last year, but I understand that it was talked about quite a lot. I know Councillor Iqbal has sent his apologies, but this is something he's particularly been working on for to be fair, for a number of years. Yes, so Councillor Anderson, for those who can't hear, is highlighted, it's been going on for a number of years, and I shared that letter that came to me, and then it came to all councillors a few days after that. My understanding from conversations with Councillor Iqbal is he's comfortable with where they are currently. I just wanted to highlight it and give members opportunity to comment if they want to. No, I take that as accepted, and that's really positive. The third thing is around cannabis and further drug and alcohol plan. Now, in terms of this, obviously the paper came to me sort of Friday, and I've read it, and it'll come to you either this evening or tomorrow, depending on Angela's working hours. I guess the question, what I'm proposing is that we take a wider view and look at drugs and alcohol, the drugs and alcohol plan in February, when we look at the suicide prevention action plan. So that's my proposal in terms of the action plan. And what would be really helpful, what I'm going to ask everyone to do is read the cannabis paper really specifically and carefully. My personal take is, with them, some of it will feed into the wider drug and alcohol plan, but a lot of the issues for communities, which I think Councillor Ritchie highlighted, is around the policing and enforcement and community safety. And so when you read it, if you let me know, what I would like to do is write to, I think it's Councillor Galton's board does community safety, and flag the issue to his board. So that's my proposal, but once you've read it, please email me, that'd be really helpful. But yeah, please do, Councillor Ritchie.
It was slightly more than that, actually. I started off on the health grounds and the impact on the sort of family life, because I highlighted the fact that now the prevalence of its use is something I'd say akin to cigarette smoking. I see most people smoking joints than cigarettes these days, it appears, when I'm walking around. You smell it everywhere. We're in a school today, and a parent came in, stood behind me, and I could smell cannabis. And it's that impact. And I know some call for evidence went out, didn't it, to practitioners. So, I mean, I'm not preempting, I've not seen the paper yet, but I just wanted to make that clear that it was that health impact about, you know, the stuff that's the rumours that are out there, that it's good for this, it's good for that. I want to know the truth. That's what I'm after.
Yep, thank you for that. And I think it's fair to say that there is some usage that's you'd refer to as self-medication, which I don't think is medically prescribed usage. But I just wanted to flag that report will be shared, and that's my proposal. But happy for you to come back with a different opinion, and if we need to append it to our paper for drugs and alcohol plan, I'll be very happy with that. So do propose that if you've seen that's appropriate. Victoria.
Yeah, thank you, Chair. So just to comment that that's absolutely fine in terms of the ask to bring back a wider paper around the drug and alcohol strategy. just to share with colleagues that that we have a newly refreshed drug and alcohol board for the city, which we needed to do in light of the new national drug strategy, and to manage the new resource that we're getting in the city for drug and alcohol treatment services. So we've got a new refreshed board, and we have a strategy that has had to be, in order to be able to kind of draw down the funding that we are doing in order for our enhanced treatment services, and we've had to refresh the strategy pretty quickly with some desperate timescales around that. So there is a live working draft of the drug and alcohol strategy for the city that's had to be done to those really quick timescales from the drug and alcohol board. But the board want to do something more meaningful over the next few months, so they will be doing some more work on that strategy. Well, they are doing it now and over the next few months. So if the proposal is February, that feels fine. It's just to share with people that is very much a work in progress at the moment and building on what we already have. So happy to share in that context. Thank you.
Thanks.
Oh, and just on, in terms of the link with this suicide prevention work, I mean, that feels entirely sensible, and obviously there is a kind of there's an overlap for some of the work for some of the people who would be affected by both. I mean, obviously they're very different agendas, and the suicide audit has now been completed and their action plan is in the process of being firmed up. So we will make the links as needed, but obviously they overlap in the middle but are very separate in parts as well. Thank you.
Super, thank you very much, Victoria. And from my perspective, if the drugs and alcohol plan isn't finalised, I think that's better, so we can feed in the opinions of the scrutiny board and what we've seen and experienced in our wards as well. So I think that'd be very positive. Yeah, getting affirmative noises, so that's very good. Okay, is there anything else anyone wants to raise from the work schedule item? No? Okay, so with that, thank you very much for attending. I feel like we've had a really good meeting, good discussions. I appreciate everyone's time and look forward to seeing you next time in December. Thank you.